Health Research Center. Yes. My name is Sohna Cham. I'm an environmental epidemiologist, and I'm co-chairing from the African Research and Impact Network, who will introduce herself. I'm an associate research scientist from the African Population and Health Research Center, and I'm based at the West Africa Regional Office in Dakar, Senegal. My research is where I'm leading the Thank you everyone for joining the webinar.
Good afternoon. My name is Leah Aoko from the Africa Research and Impact Network. It's a pleasure to be a co-chair in this session. I remember we've just had our first webinar a while ago, and this is just building on to the climate change and health discussions. So I'm looking forward to the deliberations. I'm a policy associate with a background in law, democracy, and governance, currently at the Africa Research and Impact Network, and I'm also pursuing my PhD at the University of Cape Town. So thanks, Sokna, over to you.
Thank you very much, Leah. This is how the webinar structure looks like. This webinar is part of a webinar series that is entitled Enabling Transdisciplinary Research and Action in Africa and Health in Africa, which is a component of a Wellcome funding study on community of practice for transdisciplinary research and actions on climate change and health in Africa. We know that there are a relatively well-developed climate research community on one hand, and on the other hand, well-developed health community research. But there is limited understanding, usually on the gap and opportunity for catalyzing, integrating health and climate research and actions. And given the human environmental system challenge, which is being currently faced by many societies in Africa, there is an urgent need to build transdisciplinary research and action agenda on climate change and health in Africa. To this end, the ongoing study on community of practice for transdisciplinary research and action on climate change and health in Africa, which is supported by Wellcome Trust and leading by Dr. Johannes Atela from the Africa Research and Impact Network, ARIN, and myself and Dr. Kaniva Mundi from the African Population and Health Research Center, aims to explore strategy for fostering transdisciplinary research, policy development, and capacity building in the area of climate change and health in Africa. This study funding will be instrumental in guiding investment in climate change and health research across the continents. And we are very happy today having Wellcome representative in this webinar, who is going to give us the opening remark of the webinar. Today's webinar's aim is really to explore the capacity building needs of various stakeholders in strengthening integrated climate and health research and action in Africa, and also to determine the existing effort in addressing this need and including the strengths and weaknesses, and also to identify new innovative model of capacity building that can strengthen or catalyze integrated climate change and health in Africa. We have today 4 speakers, and one who is going to do the opening remark is Miss Irini Pandilu. Welcome, Irini, to this webinar. Irini is a research manager on climate and health at Wellcome Trust, and he has a strong experience in health science research funding, fundraising, and project management. And she holds a Master in International Development from the London School of Economy. Welcome, Irini, over to you.
Thank you very much, Shokna. And really, it's such a pleasure to be here today with you all, and such an honor to be on the panel with the other speakers as well. I had some slides that I was hoping to share. Is that okay to do that now?
Yes, you can. You can share. Let me stop my screen so you can share yours.
Perfect. Thank you. So just let me know when you can see my screen.
That's fine. Yes.
Perfect. Okay, so just to take you really briefly through some slides, I won't take too long, but just to introduce Wellcome Trust to you initially. So for those of you that don't know, the Wellcome Trust, we're a science research funder. We're based in the UK, we fund globally, and our mission is to support science to solve the urgent health challenges facing everyone. So we have three strategic programs. These are infectious disease, which focus on escalating infectious disease, climate and health, which I'll speak to more now, and mental health, which focuses on anxiety, depression, and psychosis. If you know any researchers in these areas, I'd really encourage you to look at our website. We also fund very early stage curiosity-driven science through discovery research. On the climate and health strategy, we have four main goals, and these are well, the mission of the climate and health team is to put health at the heart of climate change action. And we do this through four main goals. The first one is to quantify and really help to understand what impact climate change is having on health. The second two are to find ways in which we can adapt and mitigate in ways that also benefit our health. And the fourth, which is really the area that has funded this work, is on creating a global climate and health community. So really trying to build that field. This is a quick slide to say we usually operate through open funding calls. So just to highlight there, the second one, which was on evaluating heat adaptation solutions in low middle income countries, that mandated that the PI had to be from a low middle income country. And the last one there, which we'll be releasing annually, which looks at climate change impacts and really unlocking urgent climate action by making it more visible. And that will be released again in early 2024. And so on to the capacity and field development team, which was that fourth goal I showed. So our understanding of the field at the moment is, as Sokna said in her introductions, it's there, but it's actually, could really do with strengthening in terms of collaborations, with bringing together different disciplines, different institutions, and having the diverse perspectives come together to collaborate. We also want to motivate a field that can be coherent, so where there's a shared understanding of concepts, definitions, metrics, essentially where everyone's speaking the same language, and where there is consensus as well. So really having the opportunity to have a focused policy and research community to identify what the key areas and priorities are in terms of needs, rather than having kind of separate threads of work not working together. And then also really building capacity, which is the focus of this work. So having a significantly increased skills and capacity in this area, both in policy and research and practice. We're doing several consultations around this. We've done one on the Africa Climate Week and hope to do more. And then the main bulk of the work is really this, which is led by Aaron and APHRC really brilliantly through the series of workshops, other different initiatives, and also a survey, which I would encourage everyone to complete if they haven't already and disseminate. And I think just to highlight there what Sokna said at the beginning, this is part of a broader set of questions that we are asking through this work, which will conclude in spring next year. Some of the key questions that we're seeking answers to is, what is the current context of climate and health research, policy and practice in Africa? Do relevant research and action agendas on climate and health exist at a regional and national level? What do they look like? Are there dedicated institutions who are focused on tackling climate and health in these spaces? Is there sufficient evidence to inform action on critical gaps? And then lastly, what would be the best way to bring together researchers? So we're starting off by taking a step back and really trying to listen. And big thanks to Aaron as well and APHRC for the brilliant work that they're doing. And thank you all for coming today. Really looking forward to sharing in these discussions.
Thank you very much, Irini, for your nice introductory remark. We are very happy having you here as a welcome representative, and very happy also working with you on this study. Thank you again very much. Just to let you know, so audience, that we are going to have also Monty survey a little bit for some question during this webinar. We will maybe come back on that. And my colleague, Dr. Abraham from IARIN, will guide us on that, will provide some details. Abraham, would you like to say something about the Monty? Or are you here?
Yeah, thank you, Sokna. Do you want to run the Mentimeter right away?
Oh, yeah, we can maybe after the next speaker presentation, we can run the first question. And after the second one, we run another question.
All right. Thank you. So just to brief us, I'll post a link with the Mentimeter link, so you can share your views on that particular question that we'll be posting, and then I'll be sharing the live results with us, and then maybe Sokna can take us through.
Okay. Okay, thank you very much. Welcome our next speaker. Please let me share a little bit my thing again. Okay, we invite now our next speaker, Dr. Penina Murage, who is an assistant professor at the London School of Hygiene and Tropical Medicine. Dr. Murage is an environmental epidemiology, and she was the co-director of the London School Climate Change and Planetary Health Center. He's currently a co-investigator of a Wellcome funding project on heat adaptation. She's implemented in Tanzania, where she worked with local NGO Lead Foundation. She's also co-principal investigator on a funding medical research foundation grant on climate change impact on health, where she's trying to look at how climate change, air quality, and green space can interact to affect non-communicable disease, particularly in Senegal. She's now leading the London School Master in Public Health, Environmental Epidemiology component, which is a distance module. Over to you, Penny. You have 15 minutes. Thank you again for accepting our invitation. Thank you.
Thank you very much, Sokna, and hi and welcome everybody. I have a few slides to share as well, so I'll put them on and let me know when you can see them.
Okay, you can share your slide.
Okay, fantastic.
Thank you, Penny.
Thank you for that introduction. So and for also inviting me to speak to this. So I'm actually a Kenyan native who spent a lot of my working life in the UK public health and academic space. So I feel a little bit fortunate in that I'm now, I guess, at the point in my career where I'm starting to bring back some of the skills and expertise that I've acquired and kind of bringing that back home. But I also have a very clear commitment on capacity strengthening and capacity building, and specifically nurturing future generations. So maybe what I'll do is I'll start off my talk with a little bit about my research, and then I'll continue to maybe having a look at some of the gaps in terms of capacity development and also some solutions. So this is a question that I was invited to talk about. How can international collaborations and capacity building initiatives help bridge gaps in research, data collection, and public health infrastructure to better address climate-related health challenges? Is it possible to put yourself on mute, Emily? Because I think there's some background noise.
I think it's Emily. Emily, can you mute yourself, please? Emily? Okay, let me try to call her. Sorry, Penny.
That's okay.
It's not me. I believe someone joined in using my name, but I'm not actually the one.
Okay, sorry. Yeah, because we have this background noise. Okay, it's mute now. Penny, go ahead.
I think it's better now. So maybe a little bit about some of my work and some of the international collaborations that I have presently. I think it's important to start by saying that understanding the impacts of climate change, which is the core of my work, also some of the sustainable solutions to address those. It's one of those research areas that requires multidisciplinary, multi-sectorial, and basically a global effort. And I think this is reflected a little bit in some of the work I do. So I'll start from the left-hand side there. So I have, I guess, two interrelated pieces of work that are based in the UK, but also in Senegal. And this is trying to understand what are the climate change impacts on non-communicable diseases. I think it's important to highlight who the funders are for the purpose of this discussion today. So that work is predominantly funded, the UK-based work, sorry, is predominantly funded by NIHR, which is like a huge UK government funder. And the Senegal work, which I'm co-leading with SOCNA, is funded by Medical Research Foundation, which is a funder based in the UK. In the middle part there is another piece of work that I'm doing, which is trying to look at agroforestry and how that impacts on climate adaptation, specifically heat adaptation and human health. That work is in Dodoma in Tanzania, and that's been funded by the Wellcome Trust, working with locally based partners. So in fact, it is led by a local NGO called Lead Foundation, who are based in Dodoma. And the third arm of my research work is working within the Pathfinder initiative. So this is a London School of Hygiene and Tropical based, included phase 1 of our work, which was an evidence synthesis to look at solutions that can lead to healthy futures, but also to reductions in carbon emissions. And we've just started the phase 2 piece of work, which is trying to accelerate some of those solutions, and the focus of our work will be predominantly in sub-Saharan Africa. And that piece of work is also funded by Wellcome Trust. And the second part of my job is teaching. So the London School is well known for our research, but also we do a lot of MSc teaching. So I lead on the environmental epidemiology distance learning module within the public health MSc, supervising. So that's a little my research. So I think the next part of my talk, I wanted to try and take a step back and try to understand what are those research challenges, what are those gaps. Before maybe talking about some of the solutions, it's important to understand some of the challenges. And the way I wanted to do this is maybe to pick on the 3 key areas or key gaps, at least in my perspective, and maybe drill down a little bit in terms of what the gaps are and where are the sources of those gaps. I think is quite an important one. So the first one that I came up with is this idea of the funding gap, and I think it's well recognized. So there is a piece of research that came out in 2022 by co-authors based at the University of Cape Town, and that figure is drawn from that paper. So they wanted to work out, where does climate-related funding or research funding that goes to Africa, where does it originate from? So that's the first part of that graph. And the second part is trying to understand which institutions are given that funding, and where are those institutions based. And the first thing to note, at least from the left-hand side of that figure, is that the predominant amount of our research funding on climate change and health, or climate change overall, comes from outside Africa. So UK, the EU, and the US are some of the biggest funders, but so are some of the other countries around the world, including places like China and Japan. So that's the first thing. What was shocking, at least to me, is that once that funding is offered and it's implemented, majority of it goes to institutions and universities that are outside Africa. And according to this study, it's something to the tune of 78% of that funding that's earmarked for African climate research actually goes to predominantly American and European institutions. So that's a huge disparity, and it's a huge gap. And I think, so the conclusion of this study was that, or at least it highlighted the need to increase funding for African-based researchers to strengthen African-owned research funding, and also this idea of African setting their own research criteria. The second gap, and I think it's very much related to the first one, is the evidence gap. There's probably very many factors that can explain the disparity in terms of the evidence, but here's some really shocking statistics, I guess. So they're looking at the research output for sub-Saharan African countries. So these are countries that are located in the Central, East, Southern, and Western African countries in 2018. So 10% of the global population is African, but only less than 1% of all researchers come from the continent, which is the lowest of all research output of all indexed scientific publication. It's only about 1.6%. And out of this 1.6%, 50% comes from South Africa. So again, highlighting those Southeast Asia. And then another statistics there is that only one out of the top 200 universities in the world, there's only one that's African-based, and that's the University of Cape Town in South Africa. So clear disparities in terms of the amount of the quantity, but also the quality of research that's coming out of the continent. And the last gap, I mean, there are many other gaps, but the kind of the top three, one for me, the third one was the gap in skills and in expertise. And it's not surprisingly that there's a considerable gap in skills and expertise, particularly on complex research areas such as climate change. And this could be as a result of gaps in funding. So here's some statistics from the World Bank that I put together today. So this is showing researchers in research, the number of researchers in research and development per million people in 2010. And so you can see countries like Kenya and South Africa and Senegal. So African countries are lagging a lot if you compare to some of the high-income countries such as UK and in the US. And I found this really interesting quote saying that there's a limited supply of professionals and local researchers.
Sorry, I think we still have this background noise.
Okay, all right. Okay, so this lack of critical mass really leads to poor research output from African-based researchers who tend to work in relative isolation, and they also tend to lack high-quality research if you want to produce the sort of cutting-edge scientific research that needs to take African research output to where we want it to be. So those are my three major gaps. And what I found really interesting is that it sort of leads to this vicious cycle where it's not really clear what started first. Is it the funding gap that leads to the evidence gap and also the skills gap? Or is it the fact that there are huge evidence gaps then makes us unable to compete with some of the other global North universities, and then that leads to another funding gap? I mean, it's really a cruel cycle. And so I guess the next few seconds of my talk is trying to address this cycle. What can we do? The first thing that really occurred to me is that it will require global collaborative effort, and I really think funders such as Wellcome Trust for the work that they are doing, highlighting these issues, but also try to find a solution. So yes, it will require global collaborative effort, and not just from funders' perspective, but also from ourselves, so researchers, universities, and research institutions, APHRC included, but also local governments. And so maybe what I'll do now in the next few minutes is take each one of those groups of people individually and try to work out through some solutions. So taking a lens maybe on the global South researchers. So these are research and research institutions based in Africa. What can we do, or some ideas of what we can do to take our research to the next level I think the first thing that we need to be very keen on is identifying opportunities. And there are a lot of emerging opportunities out there. There's a lot of North-South global equitable partnership. And in fact, myself and Sokna have just been awarded the Medical Research Foundation grant to take part in an equitable research partnership looking at climate change impacts on health. So that's the work that we're doing in Senegal. And there are multiple other partnerships that researchers can take part or at least try and submit applications. There's also numerous exchange programs, including travel grants and training grants and mentorship schemes that you can take part in. But the one I think I really want to highlight on is for young African-based researchers in particular to be a little bit more ambitious, where you send your research studies, your outputs. Be very intentional in being the first author, for example, because those are the things that count. So it's not just the quantity of the output, but it's also the quality. And you send it to more quality journals, that improves the quality of the output. So in terms of what the Global North partners and Global North institutions, including funders, can do, I mean, there's a lot of work that's happening in this space. So I think the very first thing that we need to acknowledge is that the global production of knowledge is not an equal playing field. So there's lots of power and resources imbalances. And some of those power and resources imbalances include things like identifying intellectual property ownership. I talked about who's the first and who's the last authors, but there's also unequal workloads and unequal resources and facilities. I just wanted to highlight the work that's been done by the Perivoli African Research Center. I attended a workshop last month, and there was a brilliant talk about this new African Charter on Transformative Research Collaboration that's been led by that research center. And it's a huge initiative. And the idea is how do we advance Africans' contribution of knowledge? How do we improve not just the knowledge that's being done in Africa, but also African produced knowledge, our own knowledge, this idea of who owns knowledge and what is knowledge. And there's also the idea of Southern theories. I think a lot of the science-based theories come from the West and from Northern institutions, but how do we build that within Africa? And I think it's a really, really useful and interesting initiative. So I think it's come up with something like 11 principles which have been endorsed by universities across the continent and across the world. And maybe just to highlight that we do need those Global North, Global South research collaborations. And this is because they dominate Africa's indexed research output. So in fact, those collaborations underpin Africa's positioning in the global scientific effort. And what do I mean by that? So if you look at some of the statistics on the average share of publication with foreign co-authors in Central and East Africa, it's about 88%. It's a little bit lower in Southern Africa. And there's a huge disparity of variation across continents in the country. But I think it's fair to say that those North-South collaboration are still very key in terms of springing us forward to where we want to be. Some other thoughts, and I think we'll be hearing more from some of the panelists today, is this idea of strengthening local funding mechanism. I saw some of these statistics today, and it was a little bit shocked. I mean, I guess it wasn't a shock, but it was a bit of an eye opener. So this is the idea of how much government funding and how much government commitment goes to research and development across different countries. And as you can see from that graph there, so this is coming from the UNESCO Institute of Statistics. So it's looking at an indicator that looks at the gross domestic expenditure on research and development per region. And you can see that the North Africa, so on the left-hand side, North America and Western Europe spend on average about 3% of their GDP on research and development. And Sub-Saharan Africa, by comparison, it's less than 0.5%. And so at the back of my mind, I was thinking, what would happen if our own governments and our own, I guess, philanthropists within the country would put in more money for research and development. And so on the right-hand side are some of the ideas or some of the thoughts of what the implication might be. So will there be an opportunity to boost more innovative South-South collaborations, for example, which is needed? I mean, remember, we still need the North-South collaboration, but the South-South collaborations are equally important. But it's also an opportunity for African researchers to drive their own research agenda, to set their own priorities, because at the end of the day, they know what the needs are better. And also this idea of generating African-owned knowledge, yeah, or in quote, Southern theories is really, really important. I think this is my last slide, a bit of a controversial one, but I guess not. As part of a solution is this idea of reversing the brain drain. I think we've all kind of had stories or experienced brain drain. I mean, I'm probably a product of the brain drain. It's a really interesting article there from the BBC that say that 90% of African researchers, or I guess African workers, would want to leave the country to go somewhere else. And then at the bottom there is this idea of how do we reverse that brain drain, and that African scientists and also African researchers can be really at the forefront of that reversal of the brain drain. So this is I guess a plea maybe to the funders, maybe something that Wellcome would want to consider, this idea of having a funding specific for researchers in the diaspora to go back home and reestablish themselves. I think that'll be a really nice, cool idea. But then, we can discuss this later in the panel. And I'd really love to hear what the audience would think about some of those potential solutions. So that's my last slide. Thank you so much for your attention. Happy to take any questions, or we can talk about them later on in the discussion. Over to you, Sokna. You're on mute. Sokna, you're on mute.
Yes. Okay, because of the noise, the background noise we had, we asked Abraham to put everyone on mute, including me. But sorry, thank you very much again, Penny, for your nice presentation. Very much appreciated. Thank you again for really pointing out these three, I think, most important aspects: gap in skills, gap in evidence generation in Africa is very key for this workshop we have today, and even for the work we are doing. Thank you very much again for pointing this out. We will maybe open discussion for question, 5 minutes if people have questions. And before we invite our next speaker, if there is any question, maybe just to follow up with your presentation, I have just one quick questions, which I really wanted you, if you can just let us know, what are the most important capacity needs now for to strengthen climate change and health research and actions in Africa? If you can briefly summarize something on that before we open the door for questions. Thank you.
Yeah, no, thanks, Sokna. I think it's a really interesting one. I mean, I would go back and say, I guess, the solutions are probably linked to the challenges. And I would say that the most immediate one seems to be the funding one. And I think, we are fortunate because there's a lot of coming now, and there's a lot of funding that's going into African institutions. So that's really good. But I think this sort of, the money needs to be aligned with the priorities. And sometimes it does feel like sometimes maybe the right research is never funded because the agenda is being set elsewhere. So it's really for Africans to try and work out what is the need, what are the priorities, And that would involve co-designing the agenda with where the funding is coming from. So I'd say that that's key. And then the other one, I mean, is the one that we've been talking about a lot, is the skills and expertise gap. But I think that is also related to this idea of brain drain, right? Because if you look at some of the health literacy rates in Africa, they are really quite high, you know, up to 70% literacy, for example. So people are very learned, but there are no opportunities sometimes. And I think that's why people prefer to move elsewhere. So I would say, yes, funding, but also the lack of skills and expertise. I mean, how do we do that? How do we resolve that? I don't know, but I think the universities and institutions in Africa will really need to do a lot more. Yeah. You're on mute, Sokna.
That's fine. Thank you very much, Penny. Maybe we can take 1 to 2 questions before we, if any, before we move to the next speaker. Okay, I see one, Momadou. Please go ahead, Momadou. He's still on mute. Momadou, please go ahead.
Okay, good morning.
Okay, thank you.
Sokna. Good morning, Dr. Penny. Thank you for your presentation. It is very, very useful. The presentation is very useful. And I have only one question. Now, actually, we are working on a project on climate change and health in Senegal. And I think that the scientific evidence is very important to give the pertinence of the project. And what I want to know is, what is the role of the researchers on this kind of project? Because in our stakeholders, we have the people from the health system, we have people from the NGOs, but we do not have researchers on this project. So I want to know if you see that the role of the researchers. Thank you.
Thank you very much for that.
Okay, Penny, go ahead.
Actually, Sokna, do you want to address that? Because it's based in your home country. I mean, I can always add on a little bit about my personal opinions, but yeah, do you want to?
Okay, just let me summarize the question if I capture it well. Momadou, you said you have now running a project on climate change and health in Senegal, but it did not really include researcher, right? And I think, yes, it is good to engage with stakeholders, but in terms of evidence generation, I think it's also good to include scientists in the project for evidence generations. And yeah, and I think this is critical, because usually sometimes where we have a lot of difficulty for showing evidence to be able, like I know that Senegal is now wanting to really apply for the Green Fund, but usually if you lack evidence on what is happening on the ground and the thing, it's difficult to access to these funding mechanisms. And that's why it's very important, this is my point of view, to always include researcher and try to have why you have this today's webinar on transdisciplinary research. The aim of transdisciplinary research is really to involve both academics and non-academics. When we said academics with different perspective, different background, different disciplines, and non-academics could be policymakers, could be community representative, could be society actors. So for me, it's very important to include scientists in any kind of research you are doing for better evidence generation. Thank you. Maybe, yeah, we will take maybe just finish this one, and all the question can be written on the chat. So interest of time, we need maybe to move after Penny's insight on this question to introduce the next speaker. And please put your question on the chat. We will come back on this one during the discussion part. Thank you.
Yeah, I think just to echo exactly what Sokna said, evidence generation is very important, and sometimes I think maybe there's not enough expertise to be involved in all policy areas. So that's probably going back to the gap of enough expertise, and maybe researchers feeling kind of drawn in different projects and different programs. So we do have to come up with a way of nurturing those future scientists and future researchers so that there's enough of them. But I just wanted to give an example of what happens, particularly within the climate change intervention area, where we don't involve researchers or scientists in the implementation. So we know, for example, that there's a lot of solutions that are currently being implemented to tackle climate change, whether it's climate mitigation or adaptation. What we don't know is that how effective are they? What are the trade-offs? What's the impact? And I think those are some of the places where we can really move things forward really quickly by involving researchers. I'll stop there in the interest of time.
Okay, thank you very much. Thank you. I see that we have a lot of questions on the chat. We will respond to all these questions, but in the interest of time, we have to move to the next speaker, and we will have some time for discussion and responding to this question. Leah, over to you to introduce the next speaker. Let me share my screen for you.
Thank you, Sokna. After a really insightful deliberation, we have Dr. Bernard coming to us from AFIDEP. So Dr. Bernard Onyango is a highly accomplished senior research and policy analyst at the African Institute for Development Policy, that is AFIDEP, and the Population Environment Development, that is PED, and as well as director of the USAID funded BUILD project. And so his work at the intersection of is at the intersection of population dynamics, health, environment. He focuses on research and policy, which is very key towards attaining sustainable development goals in middle-income countries, particularly in Africa. His current interests include providing technical support to build evidence-based and policy options to prioritize health within climate change action in Africa. Dr. Onyango holds a PhD in sociology, that is demography and urban sociology from Brown University, and is a member of several professional associations, including the International Union for the Scientific Study of Population and the Union of African Population Studies, that is UAPS. So welcome, Dr. Bernard, to give your reflections as well in this session. I don't know if you're able to hear me.
Yes, I'm able to hear you. Could you confirm if you could hear me?
Loud and clear, please go ahead.
Good. Thanks, and thanks for inviting me to be part of this really important process. I'm going to share my screen. I have a few slides that I'd like to share. Please, Leah, is it Sokna? Sokna, you have to exit sharing your screen for me to be able to share my screen. All right. Let's see. Okay. Can you see my screen now?
Yes, we can.
Okay, good. So yes, I'm going to provide some insights from our work at AFIDEP. AFIDEP is the African Institute for Development Policy, and we are an African Research and Policy Institute.
Okay.
now just over about 13 years old now. I work mainly in Africa, but we have some projects that are now have global reach beyond Africa. And really our vision as an institution is to have an Africa where evidence is used to transform lives. And so evidence, closing the research, policy and practice gaps is really at the center of our work. We have various thematic areas that you can see on the wheel with specific sustainable development goals that we are interested in, but one of the areas is environment and climate change, and we have population dynamics that at the center of our work. We have two main approaches to our work. One is, again, as I said, strengthening capacity for using evidence in decision making, and then the second sort of pillar of our work is on providing evidence and technical assistance to accelerate the SDGs. And so this includes synthesis of evidence, its translation and packaging for its use, but also hands-on technical assistance in developing and operationalizing sort of development roadmaps. But I don't want to spend too much time here. I wanted to just dive straight into some insights from work we've been doing in Kenya. And this really aligns with what we are seeing in the rest of the continent. So over the last few years, we, as an institution, we have put increasingly having priority on issues of climate change, but also particularly at the nexus of climate change and health. And one of the projects that we are implementing in Kenya is on evidence for policy action on climate change and health. This project is supported by the Children's Investment Fund Foundation and is a collaboration between AFIDEP and the London School of Hygiene and Tropical Medicine. So some of your colleagues, Penina. Actually at the outset, when the project started out a couple of years ago, it had three main objectives. One, to fill the evidence gap between climate change and health. Two, generate a greater understanding of cross-sectoral policy solutions that address the health impacts of climate change and climate co-benefits. And the third, really to build these bridges between the health and climate research and policy communities. Overall, in specifically in Kenya, but looking at what lessons can we draw from other African countries. And along the way, then we responded to a specific request from the Ministry of Health in Kenya to support them develop a Kenya climate change and health strategy. And so, I mean, this, where the rubber meets the road. We can do all our research, but at the end of the day, we want to see this, our findings get into policy and then get into practice or programming. And so one thing we quickly realized within the Ministry of Health in Kenya is that the mandate on looking at climate change and health at the Ministry of Health was being overseeing the responsibility of a very small department. So just actually at the time when we started the project, just about 3 people, and it hasn't really grown by much, maybe one other person, and we've had to also second someone to support the process. Well, so I wanted to really, in the process of developing this the strategy, which we are sort of coming to the tail end of developing that strategy, we've really been able to pick a lot of lessons. We formed a task force that has been supporting the development of the strategy, and this really had the task force draws from various sectors, various ministries, departments, and agencies that with linkages to climate change and health, but also civil society, the research community. So we have people from University of Nairobi, for example, and we also have included the private sector. And so I'll just focus the rest of my time on this slide, because it really sort of does, at least from our perspective, these are some of the things we've seen that require attention for capacity and training needs for climate change and health action. And so I think Penny have really talked a lot about the issues about research capacity, and so this is obviously a major need. There's still quite big gaps on the evidence that can be actually used to inform decision making, to inform policy and programs. But speaking from the perspective of Kenya, and I've looked at other countries in Africa as well, it's not just the evidence gaps that we are having, but beyond that, it's even the how diverse is the research being conducted around climate change and health. And if you look at the case of Kenya in particular, you find that most of the work that has been done overwhelmingly is focuses on vector-borne diseases, and then there's a bit around waterborne diseases and WASH, and you have a little some on malnutrition and other, indirect impacts, but overwhelmingly vector-borne disease. And if you look at sort of part of where this is coming from, you find the premier research institution, health institution in Kenya, health research institution in Kenya, the Kenya Medical Research Institute, and most of the work that was done on climate change there is really by entomologists and epidemiologists working around malaria. And this is then reflected in what you see in the climate change action, the policies and strategies that the country has. If you look at when they focus on health, most of it, whether you look at the National Climate Change Action Plan, the previous one, and the recently launched one, they talk about the vector-borne diseases and malaria in particular, and dengue. So in a sense, there's a lot more that needs to be done to diversify the research at the nexus of climate change and health. Speaking to stakeholders, there's, for example, you get to hear a lot of people mention, okay, mental health is important on climate change and mental health, but the evidence on that is really, we don't quite have the evidence at the moment. So I'll move to the second one, and this is even where we have some evidence, and I've said there's work that has been done over the years, whether it's KEMRI, whether it's institutions like ILRI and those at the university. So the point is that this work has really remained in the realm of the researchers and academicians, and there is really need to then strengthen capacity to access what is available and use it. So there is need to really invest in strengthening. So when I talk about, for example, as I was saying, the Ministry of Health, the people in the departments and agencies at the Ministry of Health, they're not, the reality is, even for the little evidence that we have, they're not able to access that. partly because it's in journals, it's not been translated, which goes to my my third point. There has to be investments towards the people conducting the evidence, generating the evidence, also having the capacity to translate this into formats that decision makers, policy makers, and the implementers can actually use. So moving away from the scientific jargon and really being able to talk to the different audiences in language that they really understand, and being able to provide, for example, the cost benefit analysis of these investments. As we know, one of the challenges that you're having with climate change is that some of it is, the impacts can be long term, and the policymakers are dealing with their most urgent priorities. And again, when you look at the policies and strategies, this is also a reflection of how health is being addressed in these policy documents, is also a reflection of their priorities. So there's an understanding that climate change is having, leading to these extreme weather conditions that come up, that cause humanitarian crisis. And so that is actually reflected. But then important aspects, for example, such as, nutrition, that nexus of climate change and nutrition, which might, something that's further along down the road, is something that they're not yet reacting to from the policy perspective. We've also heard from the stakeholders that the need for the climate change and health community to really understand and harness the power of indigenous knowledge. And I know this is not just for climate change and health, but basically climate change action in general. There's an acknowledgement that there's indigenous knowledge that we can harness to get better outcomes that are very context specific. My fifth point is on the issue of, and it touches a little bit on collaboration, but the fact that climate change is, and when you look at climate change and health, this involves a lot of sectors. And so to the extent, how do you build that capacity for collaboration across sectors, so that we don't have people in agriculture working on aspects that have health implications, but they're working in a silo there, and the health people are working with transport, energy, they're all working on siloed priorities, rather than actually looking at the interlinkages with amongst the factors that have effect on health, and working together towards solutions. And of course, just using scarce resources more efficiently. The other point, and I think this is really important, because we've been seeing this, and I think it's reflective not just of what's happening in Africa, but also maybe other parts of the world. Around climate change, they've been sitting at the table. I know, and the good thing is what we've seen over the Conference of Parties this year, 28, actually has a dedicated health day for the first time. They've been having the WHO Health Pavilion for a number of years, but this is the first time that this is going to be there. And as part of the process, actually, within some of the work that we've done together with other partners in the continent, was really to bring together different stakeholders, including members of the Africa Group of Negotiators, to a meeting in Malawi, where they crafted African common position on climate change and health that, has big traction, and we are doing more, partners, stakeholders are doing advocacy to get that to the highest level and move to endorsement at COP28. I won't talk about the last one, which is really the funding issue, because I think Penina covered that quite well, just as it is generally in Africa. This is a big problem in the country, and the funding for climate change and health initiatives really is minimal. But also we've noted, if you look at the funding mechanisms, like the GCF, and if you look at Kenya by African standards, Kenya is doing sort of pretty well in terms of trying to get funds from these different initiatives, but health again hasn't, is missing out on this opportunity. So you find energy, agriculture projects, energy, transport, but I don't think you can actually pinpoint any health project that has been funded through those mechanisms in the country. So really addressing these capacity needs are at the center of improving climate change and health action for a range of actors. As I said, it's from global to the grassroots, because one of the things that, of course, if you look at the what's happening in Kenya, for example, the national government on the policy priorities, the actual implementation is done by the devolved government, so the local governments. So if you're just addressing the national government without really getting these skills or closing these capacity gaps at the subnational level and even within communities, then you still not going to get the impact, the full impact. So all these, looking at the outcomes, you want to be able to design and implement effective policies and programs. But there's that agenda to really get the political commitment that will facilitate the enabling policy environment for climate change and health, and of course, the whole issue about resourcing, so improving the budget allocation and priority setting for climate change and health. So these, in our view, are some of the key things. Not just I've given an example of Kenya, but in reality, I think this really translates right across the continent. So I'll stop there. Thank you. Welcome questions.
Okay, thank you very much, Bernard, for your nice presentations. Okay, I don't know if Leah, you still here? Can we?
Yes, I am.
Okay, can we go to the Monty first and
Of
to see
course.
the questions and take 1 to 2 questions before we introduce the next speaker? Thank you.
Of course, thank you so much. Again, thanks, Dr. Onyango, for that really insightful discussion. We have a question on the chat and a link to the Mentimeter. So if you kindly would interact with it for a few minutes. And the question is, are there any existing efforts that are made towards addressing the needs and the models that are being deployed, that is in terms of climate change and health studies? So please do share your thoughts with us through the Mentimeter. The link is on the chat. I don't know if we have any existing efforts that are being made towards addressing the needs and the models that are being deployed, that is in the context of climate change and health. We have one response, quite a number, anticipating more responses. Let's have more Let's have more of that.
Yeah, thank you, Leah. Maybe in the meantime, you can read some of the responses we received in the first question. I don't know if you can see it.
Just getting there. Perhaps you could. All right. So we had a query on the capacity building needs of various stakeholders towards strengthening integrated climate and health research and action. So what are the capacity building needs of various stakeholders towards strengthening integrated climate and health research and action? So we had working more closely with the health actors to reinforce their capacities to integrate climate change in their daily work. A better understanding of how infectious diseases and other climate-related health risks will evolve alongside climate change is needed to ensure adequate health response, very key. Another point, emphasizing on collaborations and engagement that is between stakeholders in the climate change area and the health sectors, funding academic educational institutions to recruit and retain talented professors with competitive salaries, and startup research funds could help boost research productivity and training of students. Creating a safe space for aligning research with policy, which is very key, and practice. Health professionals should receive education on climate change, its health impacts, and the ability to recognize climate-related health issues in patients. Climate change and health modeling and clinical research. I think this is just a couple of answers in one, and data extraction and management. Collaborative efforts, and for us to stop working in silos and having an integrated health. So I see that we have a bit more responses here on existing efforts that have been made towards addressing the needs and the models that have been deployed. I think this is, again, still in the context of climate change and health. What existing efforts do you know of, or are you participating in, to just integrate these two concepts together? And what models are you deploying, or what models are you using in integrating such work? I see an integrated assessment of air pollution and climate change for sustainable development in Africa. I presume it's part of a project. Of course, ongoing work at the Center of Education and Research on Health and Climate Change. More awareness is needed. This is very important because coincidentally we are launching the locally led adaptation metrics for Africa at the Lake region in Kenya, and one thing that stood out was the need for policymakers to even understand the integration of climate change and health. So definitely more awareness is needed in this line, from the policymakers to the local community level. Ongoing work at the East African population, health, environment. Maybe you could just give us a snippet of what specifically you're doing or implementing. And opinion there on, I don't think the conversation on the intersection of climate change and health has even started in Nigeria. This is very interesting. Perhaps you could give us more insights into that. However, these spotlights, they need to make a case for it. Absolutely, absolutely. And then Africa CDC's One Health initiative. Of course, Africa CDC has been active in trying to conduct studies and support initiatives that are integrating climate change and health. If you are not sure about the question, I think by now you have a bit of insight. You can give us a response towards the same. So I think that's it from my end. I don't know if you can proceed to the next presentation, but please feel free to still include your responses in the Mentimeter. It is still open. We want to hear from you. We want to know what you're doing in your capacity to integrate climate change and health.
Well done. Thank you very much, Leah. Very, very well done. I think now we can move to the next speaker. I'm going to introduce her. And we will try to have a 30-minute discussion where we try to respond at the same time to the question before we give the floor to Dr. Johannes to really conclude this webinar. Thank you very, very much for your response. Please continue to respond to this Monty. Okay, let's introduce now our last speaker, not least, who is Miss Caroline Mutoni, who represent the work they do at the Climate Health African Network for Collaboration and Engagement. Ms. Mutoni is a project manager for the Unchained Belmont Research Action to support EU policymaking on climate change and health at the Aga Khan University in Kenya. She's working at the Institute for Human Development, and she's handling all country project-related activities, including being part of the Climate Health African Network for Collaboration and Engagement Steering Committee. Her work is around supporting and informing evidence-based on climate and health policymaking, building networks for collaboration among climate change and health stakeholders in East and South Africa. She's also facilitating climate and health knowledge exchange and learning, and she has extensive experience in managing project and coordinating different research studies. Welcome, Caroline, to this workshop, and thanks again for accepting our invitation. Also, you forgot to show your.
It's fine. You can stop sharing so that I can share my screen.
Yes, okay, sorry, I forgot your slide to introduce your slide. Thank you, welcome.
Thank you. I hope you can see my slide. Sorry.
That's fine.
Yeah. Thank you so much. And so I'm going to be speaking about capacity for training needs for integrated climate and health research and action in Africa is based with these webinars, and I'm going to be giving insights from an African network. I think from the beginning, the need for collaborative action within the climate change and health space. And based on this, we decided to come up with a network called the Climate and Health Africa Network for Collaboration and Engagement. which I'm going to refer to as chance moving forward. And this was the coordinating team is based is made up of a team from the University of Botswana, the Aga Khan University in Kenya, WITS RHI in South Africa, Climate Center, Cicero, and London School of Hygiene and Tropical Medicine. And this network was first put together in 2021, and it's part of the NBEL project, which is funded by the EU, Horizons 2020. And our main aim in this network is to harness synergies between climate and health in Africa. And the first one is networking and creating synergies in East and South Africa. Number 2 is facilitating knowledge exchange, learning and collaboration. Number 3 is supporting and informing policy processes. And number 4 is creating or giving technical support for national or regional funding applications. And our focus areas are around heat and health, air pollution, climate-sensitive infectious diseases, climate financing. And our key activities include meetings, webinars, workshops, and conferences, knowledge exchange and information. And currently, members are made up of people from different academic institutions, international organizations, NGOs, policymakers, people from the private sectors and research organizations. We currently have about 150 registered members in the network. And registration is just a very short process of filling in a SurveyMonkey form with your details so that we are able to reach out to you when we have some of these activities. And today I'm going to be mostly focusing on objective number 2, which is facilitating knowledge exchange, learning and collaboration, because of the theme of the webinar. And how we do this is through regular webinars and through workshops and conferences. We have activities around the other objectives that I'm not going to be speaking about today. And the first thing, as I've said, is we do webinars. These are done every 2 months. We recognize the importance of continuous engagement with the members. And these webinars are mostly also led by members who come and disseminate the kind of work that they are doing in their regions. And not just research, but we also have implementation. We also have policy development and action, because our members, as I've said, are comprised of researchers, policymakers, and other people. So we try to engage these different levels of people to come and tell us about the work that they're doing. And as you can see, it's quite broad. We hear from people in Senegal. We heard from the South African government who created the heat health action guidelines. We've heard about research on maternal and neonatal health. We've heard about efforts by WHO on building resilient and sustainable low carbon health systems, and many others. Yeah, and we always encourage our members to come and tell us about the work that they're doing, because we recognize that peer-to-peer learning is very important. And this is an approach that has been used in other public health efforts to sort of solve the problems. And this model can also be used in the climate change and health space, where we exchange knowledge, build each other's capacity, and also, exchange knowledge about the work that we are doing in our regions. The next thing that we do are in-person conferences. We've had 2 so far. The first one was in 2022 in South Africa, and the one we held this year was in Botswana. And in these in-person conferences, now we get an opportunity to bring the members together. Yeah, deeper connections are made when people meet face-to-face, people exchange contacts, people talk, and conversations now extend beyond the conferences, and people collaborate and people do work together. And the one thing I'd like to say about these conferences is that it's very rare to find spaces where scientists and policymakers come together to engage. But the Chance Network conferences are a platform for that to happen, and it's something that we're quite proud of. And these are some of the people who attended our conferences. We're very grateful for the people who put in effort to come and, deliberate and have dialogues about climate and health with us. And the other thing I'd like to say briefly is that the the programs for these conferences are sort of done together with the members. The steering committee does not sit down and say we should focus on this and this and this and this. No. And so, for example, this year, we sent out a survey to all the members for them to sort of rank in order of importance the areas that we should focus on in this year's conference. And as you can see, adaptation in the health sector was number one. And based on these results, we now went ahead to develop the aims and the program for the conferences. And 2022, the conference themes revolved around financing and policy development, evidence approaches and priorities, and also networking. And in 2023, we looked at managing heat risks. We had from people in Burkina Faso, we had from people in Ghana, we had from people in Tanzania who are working on this. We also had about efforts to reduce climate-sensitive infectious diseases. We had people come in and tell us about the existing opportunities for climate financing. And we also spoke about health adaptation. We had policymakers in the room who formed a panel who updated us on what they're doing in their respective countries. And this is also quite impressive because then they continue to benchmark each other's progress in these conferences, and they get to sort of get challenged when we hear, for example, Kenya is quite ahead in its adaptation progress, and Uganda will say, oh, what are you doing? Are these things that we can also emulate in our own countries? Yeah. And I'll talk about some of the outcomes from the discussions in these conferences. And in 2022, some of the challenges that came up we did a prioritization exercise, and some of the challenges that the members raised also echo what my previous presenters spoke about. And of course, funding is a barrier to policy implementation and also research. And members did say that there's limited knowledge on how to appropriately and effectively use the existing funds. Yeah, and there are difficult funding application systems that are complicated for some members. And there was also low capacity and knowledge on climate change and health, and also limited local research on current impacts on climate change and health. And also some of the actions that could be put into place include creating a repository of climate change and health resources, which I think some organizations have already put into place. There was a need to create awareness at top government levels so that there's buy-in at policy-making level. There was a need for continuous collaboration and to also streamline existing and upcoming policies. I think there's so many climate policies that mention health. There's a need to put this together so that we can work in a streamlined way. And of course, lobbying for climate funds to consider health. Most of the existing funds on climate rarely fund health projects. I think this year, GCF has funded its first health project, which is great progress. And of course, building capacity for members to be able to access these funds that exist. And in 2023, we had more robust discussion. And as you saw from the survey that we sent to the members, climate resilient health systems was one of the areas that was a priority. And from this, the members did say that there's a need for regional guidance and frameworks to sort of direct what climate resilient health systems are, and the need to strengthen primary healthcare using locally developed approaches, and there's a need for multidisciplinary approaches, which I think Benson did spoke about in his presentation. There's a need for health workforce empowerment, and of course to conduct vulnerability and adaptation assessments so that they can inform the health adaptation plans. And in climate finance, of course, this is still a challenge even from this year, same as last year. Health is still not seen as a priority for climate. There's also lack of capacity to access this funding, and these calls for proposals are not widely shared, something we think that we can address in the network. And also international funds are not proportionally deployed. There's a lack of coordination and collaboration among members, and there's need to deploy resources. Resources are only deployed during crisis, and we need to change that where we take a more preventative approach. And of course, mitigation is always preferred over adaptation when financing is concerned. And some of the research priorities that came up from the discussions we had in the conference include, of course, more research on climate resilient health systems, more research on air pollution, early warning systems, extreme heat nutrition, mental health, and climate-sensitive diseases. And what is the future of the Chance Network? The first thing that we did in this year's conference was to ask members to identify what are some of the areas that we should focus on in the network. And members did say that capacity development is number one. And this moves beyond not just conducting the webinars and the conferences, but to also build the capacity of early career researchers to provide opportunities for members to learn about accessing the funds that are available for climate change and health, and also to integrate climate and health in existing public health and medical courses, which I think some members have already started working on, among others. And these other areas were also ranked, including access to climate finance, which I think has been recurring over time, because without financing, it's really quite hard to progress even the capacity development. And some opportunities for the network include we need to continue to create spaces for scientists to connect with policymakers for research prioritization and translation to policy. And we can be a bridge between funders and implementers, because we manage to sometimes bring people who have the climate finances to some of these meetings to speak to the members on how they can access the funding. It is also a good platform for health decision makers to share best practices and benchmarking progress from other countries, as I mentioned earlier. And we are also working on creating a register for members' expertise so that other members can access technical support from other members. We often get requests from members, can you tell me who within the network is working, for example, on climate resilient health systems that we can bring in to support us, because we're starting the same in our country. And so having a register of the expertise of members could be really beneficial. We can also develop an online platform where members can connect regularly. And we also want to start connecting interested researchers with scholarship opportunities so that they can increase their capacity on climate-related scientists at both graduate and postgraduate level. And of course, we have members who have been quite successful in accessing the climate and health funds, and these members could come and also support other members who are interested in accessing the finances. And again, as I said, we work with policymakers. We could support and advance the development of specific health-focused adaptation policies, and also documenting case studies, success stories, and lessons learned in the region, and disseminate these lessons to avoid reinventing the wheel. One thing that we realized in the past conference is that there are people on the ground who are doing really amazing work on climate change and health, and it's important that we can tell these stories so that they are also adopted in other areas, and also, accelerate this work. Instead of trying to reinvent the wheel, we can always learn from others who have been successful in their efforts. And lastly, we can work with other existing networks and organizations to maximize impact. Well, unfortunately for the Chance Network, because it is embedded in a project, that project is coming to an end. So we are currently in the process of trying to access more funding and looking for people who can support the network to continue with the activities and build it to even have more impact within the region. And for those who are interested in registering and joining us within the network, you can scan the QR code that is provided, or you can reach out to the Secretariat, Dr. Vincent from the University of Botswana, and that's my email address. And I would also like to thank all the people who come together to make this possible. Thank you.
Thank you very much, Caroline, for sharing your nice work with us. Very interesting network. Thank you very much for sharing. Now, quickly, as we are a bit ahead of time, still have, I think, 20 minutes or something, we will open the discussion for question. If you have any question for the three speakers, we can start taking this question, maybe, or maybe Abraham, do you want to bring us to the last semantic question first before we open the discussion?
Sure. Let me share
Okay,
the
let's do
results.
that, yeah.
So the Mentimeter question is for us to identify new innovative models of capacity building that can strengthen and catalyze integrated climate change and health action in Africa. Identify new innovative models of capacity building that can strengthen and catalyze integrated climate change and health action in Africa. So just awaiting your responses. Please do feel free to go to the link that has been posted on the chat. Just go to the Menti link. We'll be happy to receive your responses. We see embrace qualitative research, social and behavioral research to identify specific areas for behavior change, and more human-centered solutions. I think this best speaks to the local community needs as well, integrating the physical and social sciences to just address the needs of the community and enhance capacity building. Another response on training health policy makers in climate change. I think we can do more. Training models that target institutions, absolutely. Schools, colleges, etc., institutions of higher learning and individual capacities. I think this has also been highlighted by various policymakers, I think, that we've interacted with. Translate research to actual actions on timely basis. Very key.
Okay, Leah, maybe let's continue, ask people to continue to respond to these questions.
Yes,
and
please,
we medicate question for the speaker, if,
yes. Yeah, absolutely.
Thank you very much.
Yeah.
Please continue.
More responses are welcome. So I think we can go to some of the questions that we have on the chat, and I believe this would be addressed to Penina Murage. What is the reason for the gaps in skills and expertise in Africa? What is the reason for gaps in skills and in gaps? What is the reason for the gaps in skills and expertise in Africa? What is the best way to strengthen the African researchers' capacity? I don't know if Penina, you've gotten that question. Please feel free to post more of your questions in the chat.
Yeah, thank you for that. So let me just try capture that again. So what's the reason for the gaps? That's the other one. And what's the second part?
What is the best way to strengthen the African researchers' capacity?
Oh, yes. I mean, it's $1 million question, right? If I had the answer to that, I think I'd be a wealthy person. What are the reasons for the gaps? And I mean, I invite the other panelists to help me answer this question. I mean, it feels to me that if we just take climate change and health research, it feels, I mean, and it goes back to what one of the panelists, I think it was Bernard, who was saying that we tend to study the same thing, and there's huge disparities in terms of looking some of the other aspects that impact us. From a climate change perspective, I think what he was saying is that there's a huge focus on infectious diseases. And so what's happened is that as we realize that climate change is so faceted, and there's so many different impacts, and there's so many different ways of looking at it. We find ourselves in a way that we don't have enough expertise to look at some of the other issues that we should be looking at. So I'll take a very specific example of the work that we are doing in Tanzania. So we're interested in understanding how some of the nature-based solutions, so agroforestry, for example, what is the impact of that on health? Traditionally, agroforestry was never seen as a health solution, right? It's very much an ecosystem solution. And so we are coming in as health researchers, trying to understand a specific solution that has been completely overlooked by public health. And the first thing that we found ourselves, the first difficulty we found was that there were no methods. We didn't know of any methods of doing that kind of research. And the other gap was that when we are looking to recruit people to do impact evaluation, there are very few people, at least from a Tanzanian setting, who could do that work. So I think it's almost like climate change has found us very unprepared. And I think we have a lot of work and there's also this larger question of gaps where, I see that there are gaps within us as researchers. There's gaps in terms of the decision makers, there are gaps in the evidence, there are gaps in skills, but also there's another wider gap, which is gaps in the population. I think a very nice way of testing this, for example, when we had a welcome meeting in Mombasa, the participants were asked to say health or climate adaptation in their own local language. And what we found out is that we couldn't even come up with a word for that because it's not something that we normally talk about on a day-to-day basis. I think there are several gaps and there are several capacity needs. It's not just one.
All right. Thank you, Penina. I think we could have one more question, and this is from Andrew Ogaba, who asks, how can we help rural women battle health challenges from short-lived pollutants? How can we help rural women battle the health challenges from short-lived pollutants? I don't know if Dr. Bernard, you'd want to chime in on that.
So that's not my area of expertise, but what I would say, I think so. It's I believe it meant short-lived pollutants. I think the issue here is and it relates to what Penina was just alluding to about how does this what for example does the research community know about these short-lived pollutants, right? And then what's being able to really communicate about their impacts, because this is something that will need the people themselves to I mean, some of the actions are at household level, right? And if I don't even understand, I mean, people have been doing things the same way in my village for the last so many centuries or decades. And if you cannot show me what the linkage between what I do within the household or our lifestyles and my health, that you see, I can't take action at that local level. So this, I think, the preventive measures, being able to be able to actually do the messaging, move it from the scientific and evidence and what is published in the journals to taking it to the local communities, whether it is in the local meetings, whether it is in the FM stations, getting champions within the villages, the village leadership or the rural, people, leaders, to talk about these issues and really make it an issue. So and in a sense, that's what I was saying. Yes, we are having we are thinking about, oh, we have all these challenges, evidence gaps, but even with the evidence we have, what are we doing with it to actually cascade it, one from policy level to programming and all the way to community level to really instigate some behavior change at that local level that could really help as a public health preventive measure. So that's what I would say. Thanks.
Thank you so much. As we draw to a close, I want to invite Sokna to just plow through the rest of the questions. Thanks.
Okay, thank you very much, Leah, and thank you also for the question. I think there is also one question on the chat. I think this is for Irini, which is asking what are the criteria for high quality proposal for well controls? Irini, are you still with us? Irini? Yeah, if not, let me just, I have two questions. One is for Bernard and one is for Caroline. Maybe let me start with the one for Caroline. Caroline, I wanted just to ask you, building with your networks, the change network, which you are trying to build research capacities that is required for Africa and so on. Can you let us know what are the mechanisms and partnerships that can be established to secure long-term financial support for climate and health research in Africa? And how can this fund be effectively channeled to address both current and future climate-related health challenges on the continent?
Sorry, I missed a section of your question.
Okay, yeah, I can repeat the question. I said, can you please let us know, tell us about what mechanism and partnership can be established to secure long-term financial support for climate and health research in Africa? And how can this fund be effectively channeled to address both current and future climate-related challenges on the continent?
Okay, thank you for the question. And so I think there are several organizations that are currently working on especially implementation of climate-related projects. But on research, we have for chance. Chance is the chance committee members are established members of academic institutions. As I said, for example, a secretariat is hosted at the University of Botswana. I come from the Aga Khan University. We have someone from WITS RHI. And so one thing that we have realized is that, first of all, there needs to be capacity building for people to understand what they can do with climate change and health funding. Yeah, so we have people who are very much interested in getting into this space to contribute in addressing some of these health impacts of climate change, but they don't understand where we can start from. What are some of the thematic areas that they can focus on? For example, as I was saying, climate sensitive infectious diseases, to sort of come up with the different areas that people can identify and establish themselves into. Yeah, and it being quote unquote a novel research place, the best thing or the most effective thing is finding researchers from other health related areas, have their capacity built on climate. What are these linkages between climate and health? Yeah, and then now once they find their place, it's very easy per se for them now to establish themselves, access funding, and also now do the work that they need to do. And what else? What was the other part of your question?
Yeah, I think, yeah.
Yeah, and I think how Chance can do this is to continue to connect people like Welcome to members who are interested in advancing this, building capacity on accessing this finance, and yeah, and when implementing, we can also guide them where they're stuck.
Okay, thank you very much. I think we still have 10 minutes left. maybe let's go for last round for the speaker, where you can maybe give us your last word, your takeaway before we go to the closing word of this webinar by Dr. Atela from the director of ARIN. I hope this works. Can you please, Caroline, let us know what is your takeaway message for this our audience and for us before we go to the closing word?
Thank you. My takeaway message is still really based on the same chance sort of output. Let us continue to build these collaborations. It's a call to everyone here. Don't work in silos. Let's work together. It's the only way we can quickly accelerate action on climate and health. Teach others who want to learn, and also don't be selfish with your knowledge. We find that in academia, people tend to keep knowledge. In climate and health, we cannot afford to do that. Yeah, so let's be as open as possible, create collaborations, learning experiences, exchange knowledge, and yeah.
Thank you very much.
Yeah.
Thank you very much. Work together, build capacity. Well noted. Over to you, Bernard, for your last word before we give the floor to Dr. Atela.
Thank you. Let me see. Yes, so for me, what I can say, I guess being in this space over the last couple of years, I've just seen, the interest in this nexus of climate change and health. I've seen it really increasing very fast. And so in a sense, we have a moment here, an opportunity to actually elevate this climate change and health as a priority. We sort of understand where some of the gaps are. So it's how do we pull together and across sectors to really capitalize on the opportunity we have now, and working across. Again, for me, this is a cross-sectoral issue. Yes, we are looking at it from the health perspective, but how do we make sure, one, that we get the health community to participate actively within climate change action space, but also how do we get those who are in environment and climate change, for example, to understand and really make health also a priority within their work. So that's what I would say, and really thanks very much for the opportunity. And I was just looking at the number of people who are on for the webinar. It also speaks to the interest, because quite a number of people have managed to stay until way past what was initially the end period for the webinar. Thanks.
Thank you so much, Bernard. Thank you very much. Well noted for the intersectoral collaboration need. Thank you very much. Over to you, Penny. No, we're running with the time.
Yeah, I think mine will be brief because it's already been mentioned. Really to emphasize those collaborations, intersectoral, interdiscipline. I think it's also important to acknowledge the progress. I mean, it was a pleasure to listen to your talk, Caroline, about the Chance Network and all the work that's been going. I think it just testifies that there's a lot that's happening, compared to where we were 5-10 years ago, which is really, really good to see. How do we build on those progress to even take us to higher levels? And I think the bit that was missing from me is the role of governments, and I just kind of to bring back everybody there. I think we need to be championing our governments to do more in terms of resourcing this and spending more money in research and development. I think that's key, and I think there was a significant gap, at least from my perspective. Thank you so much, Sokne. Thanks, everybody.
Thank you very much, Penny. Thank you, everybody. Let me just give the floor to Dr. Atela, who is the director of ARIN, and who is now leading these initiatives, this work, consultation work for Wellcome Trust. Over to you, Dr. Atela, for the concluding remark and next step.
Thank you very much, Sokna and team, and thanks to our participants, our panelists for really thought-provoking points. I have been listening on the background, and interestingly, I realized that there's a lot to learn when you're just listening. And fundamentally, what struck me as even we close this is the level to which there are systemic issues, underlying issues that really are still driving the challenges that we have, the challenges around capacity to address, multidisciplinary and complex situations, such as the interactions between climate change and health. And looking at, the presentation by Penina, that the funding flow and how that feels evidence in terms of capacity, gaps in terms of brain drain and all that, basically, shows that there is much.
Oh, you are breaking now.
To confront these issues. Yeah. Is that okay?
Okay, now you break, but it's okay now. We hear you now. Go ahead.
Okay, so let me go quickly. So I was just saying around how the big question is how to break the cycle of systemic issues around, for instance, funding that is directed, to different regions. And from what has been presented, we see that the funding to Africa is still relatively low, and that drives a lot of other challenges in terms of capacity, in terms of ability to produce evidence. So the big question is, even as we look for solutions that are transdisciplinary and are kind of working within our complex systems, to what extent are we going to be able to confront these systemic issues in terms of donor direction of funds? To what extent are donors able to, take risks with their funding and sort of support and deploy their focus, their resources into innovation? To what extent are institutions willing to go deep and beyond the cherry picking issues around? They need to work together, they need to, all brilliant things, but what do we need to do to ensure that our working together really makes sense? So I think that is why this study is very fundamental. I want to welcome for really about bringing the voices of the people of Africa, bringing the voices of the institutions of Africa, bringing the experiences such as the ones we've had, to be able to inform a much more sort of Africa-led process, and to be able to use that to sort of direct its investment in this very fundamental area of climate change and health. And as we think about these big questions, I think this conversation has to continue. Has Bernarda said that this is a momentous time, that we need to really ensure that we grab the moment. The goodwill is there, the experiences are there, the opportunities are there. How do we build on that to really, develop something very transdisciplinary, very action-oriented, and very transformative beyond what we've seen before? But of course, building on some of the best experiences and practices that we have heard of in different places. So on behalf of the team that is working on this study, we thank you so much for your contribution. And just to highlight that for the next steps, we are going to continue with the engagement. Our next webinar scheduled for after the COP, because we are going to the COP and we have a number of things lined up at the COP. Our next webinar is going to focus on funding models, because we've seen, from this presentation and of course other past engagement, that funding is very fundamental in terms of shaping things. So we will be looking at what are those funding models that could support transdisciplinary research in climate change and health. Other than that, we will continue to engage different, engage you bilaterally. There are specific issues that are emerging even from this webinar. And I think we need to dig them deep. So we are going to have some bilateral interviews in terms of key informant and in-depth interviews, which are basically aimed at trying to dig deep around some of these issues. If you are talking about funding being, not being directed, properly to Africa, if we are talking about, gaps, brain drain, and all, what are the issues? What are the deeper issues that we need to look into? So we are going to talk to you. We are going to approach you. So we just request you that, be ready to work with us in this, because, at the end of the day, it will be very, very, beneficial to all of us. And with those very few remarks, I want to say thank you again. Thank you, Sokna, for brilliant moderation, and it was a very rich session. And thank you to all our participants for engaging in this. And we will get back to you with a report, with the recordings, so that we continue to feed into the process. Thank you so much.
Thank you very much.
Good evening.
Jonathan. Thank you, everyone.
Yes, thank you.
Thank you, and bye-bye.
Thank you. Bye.
Bye.
Thank you and bye-bye.
Thank you.
Bye-bye.